right, so good afternoon, everyone, and welcome to today's guest speaker series. I'm Beverly Johnson. I'm one of the co-owners and co-founders of Silverleaf Practice Management Solutions, and we're excited to have Dr. Jon Snipes with us today. He's one of the owners at Advanced Practice Partners, and he, as more and more nurse practitioners step into finding the right collaborative or supervising physician, it is going to be critical to their success. We'll be talking about the importance of physician collaboration, how to establish an effective partnership, the services that Advanced Practice Partners offers, and tips and the other information that Dr. Snipes wants to share with us today. So Dr. Snipes, would you start off by telling us what you do at Advanced Practice Partners, who you serve, and why physician collaboration and or supervision is usually needed?
Sure, absolutely. Thank you for having me. We're excited to tell you about our company. We were started by myself and two other physicians that we've known each other for a very long time. All three of us were doing collaboration with nurse practitioners and PAs, and sort of expanding and getting to the point in some states where we were capped out, but still having people kind of contacting us. So we felt bad turning those people away, and we wanted to figure out a way to help. So we ended up forming our own company, and then going out and kind of getting our own pool of physicians so that we can help match. We can cover pretty much anything at this point, honestly. We have doctors in all 50 states. Now, obviously, all 50 states don't require collaboration, right, but there's still some nuances even in the states that some of them maybe need temporary collaboration before full practice authority. So we can help in situations like that. A few states have different rules for PAs versus NPs, and we're extremely familiar with all of the rules for every state. So if you're not sure, we can help people with those questions too.
Awesome.
We started out primarily as helping people with psychiatric collaboration. And then we have now expanded. We now do aesthetic practices, weight loss practices, some hormone replacement therapy practices, family medicine, and just in the beginning stages of expanding to urgent care as well.
That's a lot.
Covering quite a few areas now.
Awesome. It sounds like a great business opportunity that you had there that just kind of presented itself and fell into your lap, it sounds like. So for nurse practitioners or the PAs that are looking to collaborate, what would they prioritize when seeking a physician for partnership?
So we try very hard to be very transparent with our people. We charge no matching fee at all, which I think is pretty unique in the world of kind of collaboration. All of us had sort of seen how some other people were operating and able to kind of take some things that we didn't like so much and improve upon them. I would always encourage people to have a collaborator in your field. In some states, there's sort of some gray area about, does the physician totally need to be the kind of practice that you want to be? I would argue yes, but some states have sort of some gray areas and they say technically no. And that's not to say that there aren't some great collaborators out there that kind of cross borders, but by and large, it's typically a better idea to work with somebody in your field. And so
totally
we
agree.
can, for the most part, we will only match you with, for example, if you need a psychiatric provider, we will only match you with a psychiatrist. Now, we do have one provider who's dual board certified in psychiatry and internal medicine. So in that case, a little different, but still that person is a psychiatrist. The same with every other field.
I think that's extremely important. And we get asked that a lot in our Facebook group. They're asking other providers. And I know I think there's one state out there I read somewhere that a veterinarian could even be there. They're collaborating. And I'm like, that's crazy. Like, how would you defend that?
I haven't seen that.
You haven't seen that? I think
I haven't seen that one.
Texas.
Wow.
I thought I read somewhere, or I saw something somewhere in one state that said a dentist or basically anybody with an MD behind the name. And I was like, wow, that's crazy. How would you defend yourself in court if you had that type of collaborator, like
And
kind of
that's, I'm glad you mentioned that, because I mean, I have all three of our owners, me included. I'm actually licensed in all 50 states and
Wow.
DC. So I've read everything that can be read about the
Mhm.
requirements of collaboration, and some states it's just written in an unclear way, and some of it's left up to interpretation. It may have things like, the collaborator must be familiar with your area of expertise, and that's
What's familiar? How
what's
familiar?
like what's the criteria for how familiar they've got
Yeah.
to be.
They take a
And
class in medical school, or have they actually? Yeah.
put some
Yeah.
people in some tough positions, and in some cases, I mean, we've reached out to medical boards and nursing boards for clarity, and in some of those cases we've gotten clarity, and some of them we've gotten back a gray area answer.
Yeah. I was
So
going to say,
that's
good
what,
luck with that. It seems like those
yeah,
people are never good at giving you exact
they're
direction.
not.
Those
Yeah, but I
government
know
or
that's
government
frustrating
people.
for people seeking collaboration. So we can do our best to give you the best answer we can. And if there's any question, we're going to err on the side of caution.
So, Dr. Snipes, many nurse practitioners might wonder about the logistics of kind of starting this collaboration with you guys. How long does it typically take to get matched with a physician through your services? And then what happens if the partnership isn't that great? Like if they just don't mesh personality
Sure.
wise, or if something like that happen, somebody decides to leave. How does that work?
Yeah. So, honestly, thanks to you guys, we now have a great website set up, and people can go to our website, which is advancedpracticepartners.com. It is past tense. There's a D in there, advancedpracticepartners.com. And there's a video of me, and there's a get started button. That leads you to a form that they give us some information, and then our coordinator will reach out to them. There's also links on there that they can set up a no-cost meeting with any of the three owners of us if they have kind of specific questions. And we can usually meet with people pretty quick, 1 to 2 days type thing. There you can kind of tell us what you're looking at, what you might need. If there are questions you have, or if there's thoughts, we can happily advise you. And one of the things that comes up a lot is people sometimes will say, well, I'm thinking about, maybe I need collaboration in these 5 states. And we can do that. But honestly, in most cases, we kind of advise people like, well, are you sure you want to start with 5 right out of the gate? Maybe you want to start with
Exactly.
1 or 2, or even, this state is probably going to be more beneficial for you than this state. If we're comparing a high volume state like Texas versus a lower volume state like Kentucky, we can kind of, give people that information.
Mm.
When you get to the point of saying, okay, I want to start December 1st, or whenever, we have on our website, we will match you within 7 days.
7 days.
Honestly,
Okay.
in most cases, it is much faster than that, 2, 3,
Awesome.
4 days. We typically will meet with the collaboratee, or the person needing collaboration,
Mm.
and get an idea of kind of, is there any special things that you do or any special population you see, and then kind of present that to one of our docs. He or she usually will say yes. If rarely there's something that say, well, I don't really do that, and we
Mhm.
can find someone else. But and then they'll usually kind of set up a meet and greet, and the process from there is pretty automated. We would send you a DocuSign document, send it to the NP or the PA and the doctor, and that's it in almost every state. Now, there are a few states that do have an additional step, and we would tell you that. So if you're not sure, we'll tell you. Most of the time people do know that. But for example, Pennsylvania has a website that you have to go onto and just kind of enter your information there.
Interesting.
And those things are usually pretty easy. They're usually pretty quick, but there's in that case, we would kind of give you the information, give you the website, and just say, all you got to do is click on this, and then boom,
Enter
you're
all the
good to go.
information.
Yeah.
So it's good that you walk them through the steps, though, because they don't feel
Yeah.
like they're just kind of left
Um,
to figure it out for themselves. It can get a little daunting.
as far as the second part, we've had very few instances where it just wasn't a fit, but I mean, it does occasionally happen. Maybe
Mhm.
somebody just maybe it's not a click or whatever, or maybe there's a time zone difference, and after working together a little bit, maybe it just seems like, hey, it's a little difficult. It might be easier if I had somebody in the same time zone.
Mm.
All you do is, send any one of us an email or set up a meeting with us, or just contact our coordinator, and we'd be happy to pair you with a different provider.
Good. So they
And
can, that's a pretty easy process. Then within a few days, they
yeah.
can get a different provider if they need to.
Oh, absolutely. Yeah. And there
Awesome.
won't be a gap. It's not like you won't like drop off of Dr. Jones and then have a 3-day gap where you're not covered. I mean, it would be
Right.
seamless. You'd have coverage, but I mean, I could probably count on one hand the number of times that's happened. But
Good.
yeah, if anybody wants to switch, not a problem at all.
Well, and it's not always like a bad fit, right? I mean, unfortunately, we all have an expiration date, so that could happen. Somebody could pass or
Yeah.
something like that, or
Well,
life stuff gets in the way, somebody gets sick and can't do
one
it
of our
anymore.
docs decided to take another job a few months ago, and so we seamlessly rematched his providers, and it wasn't a problem at all.
Awesome. So that's helpful to know. And so I know providers are going to ask, what are the costs? What does it cost? So what are the
Mhm.
costs associated with these services? And how should an NP plan for this? Like if they're going to start their practice, is there any gap there? I guess you could say, like, if I know I'm going to start my practice in January, and it's November right now, do I need to start right now, or can I like reach out to you guys, get all the process kind of going, and then it starts in January? Like, when do I pull the trigger and I know that I have to pay this amount every month? Is I know I get asked that a lot from providers.
Yeah. So it's never too early to reach out to us. If nothing
Okay.
else, we can kind of give you the information that they need. So you can reach out to us. We had one person reach out to us that wasn't even graduated from NP school yet.
Oh wow.
They're just wanting to kind of know, and information's free. But at the same time, I mean, it's never too late. We
Mm.
also had a weird situation a few months ago where somebody needed like a collaborator Monday morning, and it was Thursday afternoon.
Oh my gosh.
And we got it done. I mean, that was
Kudos.
extenuating circumstances, but we got it done. But for the most part, the easy answer to the question is about a week or two kind of before you need to go
Okay.
live is plenty of time. We can kind of go ahead and get the match set up, and we really don't start billing until whatever start date you pick.
That's good. Okay.
Yeah. Now, the flip side of that is there are some states that there's a strict limit on the number of NPs that a physician can collaborate with. So it's not like we can match people and say, we'll start the match, but if you're not going to start seeing patients for 4 months, we won't start billing. So we do have to kind of work under those requirements as well. But
That's
usually it
reasonable.
works out pretty well for everybody.
Yeah.
One thing that I would advise people, I mean, certainly, you can never contact us too early, but if you're thinking about pick any state, say I'm thinking about expanding into Florida, you obviously don't need a collaborator until you've gotten a Florida license. So
Right.
go ahead and do that. Now, if you want to call us and talk to us about it, that's totally fine. We'd be happy to kind of give you info about Florida and talk to you, or any
Mhm.
state really, but
Okay.
don't think that you need to have it like that far in advance.
And the costs for
Yeah.
the different states and your packages or whatever you have there.
Yep. So all this is on our website, by the way, but we have essentially 3 packages, and then one that's a little different, but I do want to mention it as well. And for simplicity's sake, we called them like bronze, silver, and gold. And the reason is um, the bronze is typically for people kind of doing part-time in one state. Maybe you have a full-time job and you're sort of transitioning into a private practice model, but you're only working 10 or 15 hours a week. So we kind of have an entry level for that starts at 800. Now there are a few states that don't fall under that, again, because they have super strict limits and they don't let docs count them as um, a full-time equivalent versus just a individual person. So some states will allow me to say you can have 4 full-time equivalents, which means I could have 8 part-time if they're working 20 hours a week, and that would still
Oh, I
be
gotcha.
okay. And others say you can have 4 people, no matter
Yeah,
if
it
they're
doesn't
working
matter.
1 hour, or 50,
Gotcha.
we're not dividing it. And then from there, we move up to silver, which is 1,000 a month. And that's for, full-time in almost every state, or people that might need 2 states or so. And then we do have a gold, and the majority of people are not going to fall into that category. There are a handful of states that require kind of above and beyond requirements for the MD. Texas, Georgia, Oklahoma, those type of things. Tennessee also requires quite a bit of work. And so that would be kind of the gold package. And again, this is on our website, but we're also happy to talk through it with you. We do also, one other thing I want to mention, we have a lifelong learner package, which is only $200 a month. And that is for people who may be practicing in states that don't really necessarily need a collaborator, but they would love to have access to our WhatsApp group and our monthly lectures and our drop-in
Nice.
office hours. So in some ways, you kind of get a unofficial collaborator. If you want to drop into our office hours and talk with me, or talk with our other 2 docs, or if you want to be part of our group, but you don't actually need collaboration, then that's kind of who that's designed for.
Oh, that's a really helpful thing. That's real helpful for maybe new grads that are in a state that they don't need a collaborator, but they would like to have the ability
Right.
to be someone's ear if they have a problem, or if they want a specific question, or even established providers that may have a difficult case
Yeah.
that they're just real sure where to go from there. So that's been, how much is that one a month?
That one's only $200 a month.
That's not a bad deal for sure.
Yeah.
And we know that these prices may change. So if somebody's watching this a year from now, those prices may be different. But
As
at
of
this
today.
point in late 2024, that's what they are.
We do also give people 50% off for the first month when they're starting out their practice. If you have a unique situation, talk to us, and we'll, sometimes things come up that don't fit into one of those 3 categories. So we can make some kind of custom plans as well. We have sometimes people that need multiple states. I think we had one person that needed 15 states, and
Wow, that's a lot.
we can do it. In that rare case, we might not be able to do it in a week, although I think we actually did still in that case, but
Oh, wow.
I don't remember exactly, but we might need a tiny bit more time if you need 15
Scrambling.
states.
And
But we
I
can
would think that'd be
cover,
pretty scrambling pretty
yeah,
hard to do that in a week, but
we'll figure out anything. And we've also had some practices that have contacted us, and maybe they had 4 or 5 providers, and they
mhm.
wanted to ideally get them all with one doctor. So we can do that as well. Obviously we have to follow state regulations,
Right.
but we can, we can likely do anything. We haven't had anybody come up with anything yet that we hadn't been able to
That you
do.
couldn't help with. That's good to know. So what challenges have you seen with connecting providers? Are there, states that are more difficult to match providers with? Is there anything that you can just think of that really sticks out that that makes it a little more challenging? You mentioned states earlier, specific states, maybe things that, providers should be aware of that in that state that they may have challenges, with this or that. Can you tell us a little bit about that? Any challenges you've seen, or, if there's difficult
Yeah,
states?
sure. A lot of times people do know that, but if you don't know that, that's okay. Call us and we can, or email us, and we can let you know if there's anything unique about your state or whatever state you're thinking about. So if you're watching this and you're like, oh crap, I don't know if my state is
Yeah.
hard, don't worry, we can tell you. Obviously the more states you need, the trickier it becomes. So
Mhm.
that's one aspect. That's pretty obvious. Outside of that, some states are easier than others. A lot of states are either they don't have a cap, or they don't have any kind of online registration or anything like that. Compared to others, the ones, Alabama's kind of difficult to work with. Mississippi, South Carolina, and Tennessee still have some geographic restrictions that
Mm. Yeah, I
Mississippi's
forgot about
particular.
that.
Yeah. With South Carolina, the doctor has to live in South Carolina.
Mhm.
With Tennessee, they have to it's just a super high number. It's 20% and 100% of controlled substances, which is
A lot.
head and shoulders above every other state.
Yeah.
So it's tricky. Mississippi also has really strict geographic requirements. So there are a couple states like that that do make it a little bit challenging. And then some of it also kind of depends on what you're doing. If you have an in-person clinic versus 100% virtual or 50-50, that can sometimes impact it with a few states. But again, if you don't know
Don't know
that,
the
don't panic. You know, information is, we're happy to talk with you and let you know.
awesome. Yeah, because I think some providers, they may know, but I think it's different when you go to work for somebody, right? And they supply your physician for you. They don't really have to know the requirements. They just know that they got their physician collaborator and they can just work. But when you go out on in your own private practice, they're like,
Yeah.
what do I need to know? What do I, what needs to happen here? And then we do
And
here certainly see a lot of telehealth providers that just want to be strictly telehealth. And they may live in a different state and they're doing telehealth into another state. And so they just kind of get confused on, what exactly they're supposed to.
absolutely. We have
So
tons
it's
of
nice.
providers.
Yeah.
We also, another question that we get a lot, there's roughly 10 states or so that are not initially full practice. Maybe you have to work for a year. I think a few of them are 2 years. Most of them are roughly 1 year. And then you can, apply for full practice. And so we've had a number of providers that do that. And at the end of that, usually the doctor has to sign some kind of form or something like that. And none of our providers have ever had a problem signing that. I've done it several times myself. So if you are starting out and you're kind of thinking, I want to do this, but a year from now, I'd like to be full practice. Great. We'd be happy to help. And then, that would be an ideal person. We can transition you to our lifelong learner package.
Yeah, for sure.
And by the way, none of these are like locked in. If your practice changes or if something changes, you can kind of move between groups. If you start out in one state and 6 months later you decide to add a second state, we can work with you. And hopefully we can use the same doc, but maybe we have to do two. We'll figure it out though.
Is there a contract with you guys? So if I sign today, am I locked in for the year, or is it just a month-to-month type of thing? I know people get a little worried about being locked into a contract.
Nope, month to month. We have a 30-day termination request, or
just let you know 30 days.
Yeah, just let us know 30 days ahead of time. All of our billing is done through bill.com, so totally free for them. We can set up like auto draft, which most people like. It's very, very easy. Yeah, it's really kind of set up to be pretty automated at this point. Yeah.
As painless as possible.
Yeah.
That's
I
don't know about you, but I like all the painless stuff. Do what?
Absolutely. Yeah, people don't want to worry about it, and they don't want to have to.
No, you got so many other things going on. If you could just automate stuff like that, just it's one of those things off your plate that you don't have to worry about. I know you touched on this briefly earlier, but if you can tell me again, what specialties do your physicians assist with, and are there any that they just don't do? Like, so, if there's any special, so they know kind of going in with you guys.
Well, yeah, I mean, unfortunately, there's much we don't do yet, but we might be expanding into that. We started in psychiatry, and then we expanded into aesthetics and family medicine and urgent care, and now looking at a few other things possibly for 2025. Oh, and hormone replacement therapy as well. And then in each of those, there's a few sort of subcategories. Psychiatrically wise, we certainly can cover basically anything. If you have a
addiction medicine,
ketamine clinic, maintenance assisted treatment clinic, IOPs, we can cover anything like that. Really any age group. So we have people, we don't have a lot of people who want to see 100% children and adolescents, but we have had a few. But we have a lot that want to do kind of full spectrum of life, and we have others that want to do only adults. We've had a few that want to do only geriatrics. So, call us and talk to us, or set up a meeting and talk to us, and we can match you with somebody that can do all those things.
Okay. Is there anything right now that you can think of that people have asked you for that you don't provide? I mean, again, we're in late 2024, so at any time you can always add things on. But if I was watching this video tomorrow, and I'm thinking about doing a specific type of practice that I wouldn't necessarily reach out to you guys for, because I know right this moment you don't provide that.
I mean, the specialties, those are the ones that we're covering right
Yeah.
now. I mean, we did have somebody reach out about OBGYN, and we're not into that yet.
Yeah.
Never say
Okay.
never. We don't know where 2025 will take us, but
Yeah. You never know.
that's just an example. But
Okay. They can always call you though, or they can reach out to you.
yeah,
And
you can reach out to us for sure. I mean, we do have a cardiologist on staff too. So
oh wow. Yeah. I mean,
we're
there's
just
so
keeping our
many
options open. Yeah.
yeah, different specialties and stuff. So if what do you wish most providers knew before they consult with your team for collaboration? Is there anything you'd want to like make sure that providers knew coming to the table, or that they have ready coming to the table before they come and see you?
Well, there's nothing that you have to have. I mean, we
Okay.
have people call us and they don't know anything.
Mhm.
They haven't even decided 100% which state they want to operate in. Maybe they have 3 licenses from their previous job, and they're thinking, okay, I'm starting a private practice. Do I want to do all 3, or do I just want to do 1 or 2 or what? So, there's nothing that you absolutely have to know, but things
Okay.
that help. The more you know, the better. I mean, I do again. I tell people it's a good idea to know roughly how long it's going to take to get a license in that state if you're
Mhm.
interested. DEA licenses as well. I'm aware that some states it's hard to find a clear answer. Although honestly, a great resource for that is our WhatsApp group. Because basically at that
For the
point
DEA.
you're not Googling, you're just asking peers, hey, did anybody get a DEA license in Kansas and how long did it
Mhm.
take? And somebody's going to chime in and say, yeah, it took 2 weeks, or yeah, it took 4 months,
Right.
or
We
whatever.
found that we found that providers are having problems with that because of the in-office requirement, right? So even though the
Mhm.
Ryan Height Act hasn't gone back into play, the DEAs in some of these states are already saying you have to have a physical space. We don't care if you want to just do telehealth, you have to have a physical space. They just won't. I mean, they're doing unannounced site visits even to these addresses that providers are providing them. And then there's been some states that these co-working type of office spaces have worked up to this point. So like WeWork, Regis, Da Vinci, those type of places have worked, and now they're getting shut down, from the DEA for those type of places too. So it's kind of a work in progress.
Yeah,
It seems like that things kind of are still fluid, and everything. And
they
each
are.
state has their own DEA requirements too. I think people forget about that. That you have the government that has the Ryan Height Act, but states can also tighten that up a little bit as well. So
And
keep
we
it.
are, I didn't really want to become an expert in that, but I had to. So
Yeah.
if you don't know, we can give you that info too.
Okay. Awesome.
We're as plugged in as anybody could be. One thing that actually going back to your question, if you are in a state that requires a physical location, we don't have physical location. So occasionally people will ask, do you guys have an address I can use? And the answer is unfortunately no. We don't have a physical address. You know, Again, the WhatsApp group can be a resource for that. We have had some
Yeah.
people, kind of talk and figure out how to work together and solve some problems, but we don't have a location ourselves.
Yeah, we tell people that it's important to know that, especially if you are going to take Medicare, or if you're going to be prescribing controlled substances, that you will have to have a physical space. It's just not going to, it's not going to fly having these virtual places. And some people will try to use their registered agent. That's not going to work either, because if Medicare shows up, as your, when they're doing your credentialing and it's not your office, they're going to deny you for 6 months. You can't reapply for 6 months. So it is, important. It's kind of a hot topic, I guess, that a lot of people have, because we'll have people in our
Yeah,
Facebook group chime in and say, well, I've got a virtual address. It's like, well, that's good. That's good that it's working for you now, but at some point that may not be a workable option. So anybody that we're setting
I
up from
agree.
here forward, we're like, hey, have a backup plan. Even if it's just sharing an office space with someone that you can get mail
Yeah.
to, and you have a presence there, right? Even if you're only there once a month, just
Yep.
having that already thought out, because it can be a
Yeah.
roadblock for a lot of providers. Yeah.
Totally agree. Yeah, we've had the exact same thing on our end, and we've seen the same thing. There's been some states that have approved those virtual offices, but some of them are now kind of not doing it anymore. And my strong suspicion is that more of them are going to move towards not accepting it. And
Mhm.
we've had others that never accepted that from the
Accepted
get-go.
it. Yeah. I think more insurances will start following along too, because we know that usually they'll start following kind of how Medicare does things. So
Mhm.
just be prepared. I always tell people have a plan B in case this doesn't go through for you, because you just don't want it to put a hard stop in you opening up your practice. So I understand that
Um,
Silverleaf has helped you, it has been a valuable resource for you and helping you with your business and stuff. You came to us and needed a bunch of things done. Can you share a little bit how we've helped you support all your efforts in getting advanced practice partners going and profiting and
Absolutely. Yeah.
succeeding?
Yeah. We started, and I like to jokingly tell people that, we're pretty experienced doctors, but we were not necessarily experienced businessmen and women,
Right.
and we were kind of winging that part. And our company grew quickly, which was great, but we didn't even know enough to know that we weren't ready for that growth. And
Right.
fortunately, found you guys. I don't think we even had a website before you guys.
Mm-mm. I think
And
you did, but it wasn't that great.
it wasn't a good website.
You were
Yeah.
like, we
It
need
looked
some
like,
help.
right, Windows 97 version of
Yeah.
website. So, the first thing that you guys did with us was work to automate our input and our organization. Because prior to that, we were literally typing things into an Excel spreadsheet, which was just eating time left and right. Um, and then from there, we built the website out. And then from there, we actually, put video content on the website and even improved our, I don't know what the term for it, but ability to kind of click, set up an appointment and enter
Oh yeah.
data, and boom,
Yeah.
it goes.
Yeah. We got your intake queue, Matt, talking to your
And
website and people just
yeah,
go in there and fill out your forms. Yeah. And then book
right.
appointments.
Yeah.
Yeah.
We couldn't have done any of that. We don't know any of that. And then the most recent thing, so all that, we did all that, and it's going very well. And then the next thing, we don't know anything about marketing. So, your people have been great about that. They set up um, social media presence for us, and ads, and they set up um, Google, Google searches or
Google
whatever.
business.
Yes. Yeah.
Yeah. All the Google. I don't know all the terms with that stuff either. I'm a nurse, not a marketer, but
Right.
those guys over there.
Neither are we. Yeah.
Yeah.
But Sharif and Vasily, those guys were great. I mean, they met with us, and they were able to talk to people that don't know anything about marketing, but kind of walk us through the process
Awesome.
to get us where we need to be by telling us what questions we needed to think about, if that makes
Right.
sense.
No, it makes perfect sense because we all talk different languages, right? And depending on what our profession is, and
Right.
having somebody it also takes that weight off your shoulders too, right? I know we need to market, but I have no idea how to do it. So if you're able to hand that off to someone and go, just do what you do, let me know what you need, then that's another thing you
And
don't
it
have
was
to.
painless.
Yeah,
It was a couple meetings, and it was, I mean, they were pretty entertaining meetings. Honestly, I was pretty interested and enjoyed talking to those guys. And then I don't know, a week or something, real quick, all of a sudden my own company popped up on my Instagram, and
that's pretty cool.
our ad. I was like, wait, this is us. It's
Yeah, isn't
very
that funny
exciting.
how that works?
Yeah.
Your videos, you may notice this at some point. I've had people after they've watched my videos online, right? They'll when I have a meeting with them, like, oh my gosh, I feel like I'm talking to a celebrity, and I'm like, I'm not a celebrity, just me. But they have that feeling. I guess it's the video world that we live in, or whatever. When they
Yeah.
see your face, and you're like, that's kind of weird, because I definitely don't think of myself that way. But yeah, it is cool to start seeing your ads pop up in your, in your timelines and in your feeds and your different. It happens to me in TikTok too, and it's funny when I
Yeah.
see a competitor or something like that. I'll be like, hey, they're doing this, and I'll send it to Vasily and them. So yeah, it's kind of funny how that works. So I'm glad we were able to help you, and definitely let us know if there's
Yeah.
anything else we can help you with. So Dr. Snipes, before we wrap up here, is there anything else you'd like to share or mention about your services that our guests might find useful?
You know, I feel like I had a thought a few minutes ago, and now it's slipping my mind. But I mean, essentially, oh, I did want to mention, as far as kind of what people get for our services. So number one, we cover the malpractice for all of our doctors.
Okay, that's
So
good.
you're not required to cover any of their malpractice. In most cases, that saves people about 2,000 a year, give or take, plus minus a little bit depending on what you're doing, but
Mhm.
some money. All of our docs will meet the state requirements. We do have drop-in office hours as well. Kind of a monthly video lecture versus some of them have been kind of about, dealing with insurances. Some of them have been more administrative based, I guess is the word I'm looking for. Kind of administrative questions. If you have multiple people in your practice, talk to us. We can sometimes work with people and kind of work out some sort of a group package. If you yourself need multiple states, set up a meeting is probably, if it's 2 or 3, we can probably give you an answer over email. But if it's a unique situation where it's, okay, I've got 7 and this is what I do, probably best just to set up a meeting with one of our owners and we can easily talk you through, but we can cover it.
I know Lauren's got a newsletter too that she sends out, doesn't she?
Also the newsletter. Yep.
Her newsletter is really good. I get it in my email box, and she's actually really good. Yeah, for a doctor, I was surprised. I was like, she writes really, really well. Not that you guys can't write, but you know what I'm saying?
No, yeah.
I don't know if she's got like an English background or what, but it's really, really good.
I think she does actually. Yeah. So we have a monthly newsletter which she writes, and then she also has a blog that she writes about once a week or so, give or take. And they're really awesome. I enjoy reading them.
It's very informative, even for me. Like she did one on addiction medicine that I thought that was really, really good. Sometimes I'll put them in my little folder to read later and I forget to go back in and read them. But the addiction medicine one was very emotional and just, really caught your attention. And, you just see a different side, and she's just the way she speaks and the way she writes. Because I'm from South Texas, right? I'm from Texas. So I write like I speak. Sometimes I have to go put it into Chat GPT or something to make it sound more professional. But her writing is just very, very good. So let her know that. I did email her once and tell her about the addiction medicine one, but I recommend everybody go and get her newsletter because you can just sign up for that too.
This has been great. I really enjoyed it.
Yeah, I think, thank you so much for your, insightful conversation. And, and it's very clear that, this is definitely something that providers need. We know that already. So if anybody's interested in learning more about Advanced Practice Partners, you can reach out to us. That's easiest to support@silverleafpms.com. You can also go to advancedpracticepartners.com and reach out to them. Just let them know that Silverleaf sent you over there. And a big thank you to our audience for joining us. We hope today's session was very informative for you and it gave you a better understanding of, how to navigate the scary thing of getting a collaborating provider. So stay tuned for our next session in our guest speaker series and hope everybody has a wonderful day. Thank you again, Dr. Snipes. Take care.
Thank you. Take care.
Bye-bye.
Bye.